Welcome everyone to today's session on health data, the future of health data, which is a subject that is in everyone's mind. It's such an important topic that affects our daily life and will definitely has an importance for our future and the resilience of Europe. Today, I'm very honored to be here with Jaana Sinipuro. She's the project director at Sitra, and she's been doing work and developing work for the digital health approach that has made Finland a leader in this sector. She will be giving a keynote speaker on this topic, and then will be followed by a discussion panel with Cátia Pinto from SPMS. She works at the Advanced Analytic and Intelligence Unit, and João Norte, which is the CEO of Health Market Research. So we'll have a very interesting discussion with a view from the public and private sector. So I know the audience will appreciate this session, and with that, thank you so much. And Jaana, I pass the floor to you.
Okay, thank you very much for this nice invitation. It's my pleasure to be here and share some insight from the Finland. I will use some slides just to make sure. Yes. Okay. So just briefly before I go into actual topic about the importance of healthcare data or health-related well-being data relevant to health. A few words about Sitra and my background. I have a long history working with data and analytics, and currently I work in a Sitra's project called Fair Data Economy, which is our response to the European data strategy and builds on the work that we did in Finland during the Finnish EU presidency, promoting the principles for human-centric data economy. But Sitra is quite unique organization. We were founded in 1967 as a gift from the Finnish Parliament. So we are very independent. We run on our own funds, about 160 people working for the well-being of the society. So currently, fair data economy, sustainable solutions, and democracy and participation are the core themes in Sitra operations. We call ourselves a think, do, and connect tank. And as you can see from this slide, we are very heavily engaged in different data-related initiatives around Europe. So my previous project, Digital Health Hub project in Finland, we were laying foundation for FinData, operating model, national permit authority, taking care of working as a central authority for secondary use of healthcare data, and also being backed up by the legislation, the very first legislation on the secondary use of healthcare data we planned in Finland. But in addition, I think it's very important at the moment how much is happening around Europe. There's this official project towards European health data spaces where authorities are aiming to create larger pools for data for research and innovations. And of course, the COVID crisis has created urgency for that. But also industry-led initiative. GaiaX initiative and health hubs working there are very active in creating the European approach for creating data pools and broader access to data based on European values and decentralized models. So I think we are really into something, a very hot topic and something very relevant and up-to-date topic that the whole Europe is actively finding solutions for. And I think it's time that we take our destiny in our hands, because technology is becoming embedded in everything. It offers lots of options for data gathering, but it's also a risk if we don't balance between the interest and rights and views from all the stakeholders, how we want to use technology, how we create controls for data, and how we plan our data governance structures, mechanisms in a fair and human-centric way. At the same time, we are seeing a lot of new players entering the healthcare field. Of course, we already have many patient organizations or patient associations and voluntary communities building their shared experiences on the Facebook. So there are lots of commercial platforms that are gathering lots of healthcare relevant data. And it's very hard for those who use that data and also for those people to control how much data they donate for these private actors. So I think this data economy, and it's helping a lot. The new technology is helping a lot, but it also challenges the traditional ways we are thinking about data and how we want to handle data. We need to agree on rules and create more transparency on data strategies. And I think that there's more and more asked from the consumers, from the patients, from the individuals to be a little bit more sustainable in the data use. And that's why I think all companies and also the public sector needs to be much more transparent in the use of data in the future if we want to ensure that there's a trust, and all those digital services we want citizens to use are trustworthy digital services. So basically, fair data economy is my viewpoint where I come from, making more ethical database products and making sure that all stakeholders apply to the same principles. We, in my organization, we share the view that this is something very relevant for the future, that we try to, we need to redefine the rules, how we are handling the data. So these are just some key terms I would like to highlight in this presentation. There's lots of confusion and different terms. We just learned about big data. We just learned about AI and data lake solutions for near real-time data processing. And now we are introducing a next term called data spaces, a loosely coupled data storages and data spaces that connect to each other through the soft infrastructure and are built on the data sovereignty principles. So, and there's a strong move towards more decentralized architectures, more decentralized approaches to data. But if we move towards that direction as an opposite to the platform-based models, then we need to have common principles, and we need to have those common data sharing network rule books. We need to agree on rules, create our own code of conduct on how we want to share data, how much transparency we want to create on the data sharing and data-based services, digital services. So one very good approach, again, a new term, is the data equity. But I think that this definition is very nice, because at the same time we can talk about equal access, equality in having access to data, and also we need to consider data as a very valuable resource and asset for the company that deserves its own data strategy and deserves own rules for sharing and reusing the data. It's reused data that creates more value, not stored data or siloed data. But at the same time, I think that if we want to ensure the trust from the citizens, even in the future, if we want to ensure that there are data altruism practices in place, we must balance between different stakeholder needs, personal interest, and also privacy rights. We need to create a mechanism to balance between these three topics. And from here, I think this concept, we need to start thinking data in two ways, both as a part of the corporate sustainability. At the same time, when we are very open about our environmental reporting, we need to be very open about the practices we are using for data gathering and the use of data. So that's why I really like this concept of data as an equity, or data as a common good. It's an infrastructure. It should be treated as electricity or telco standards. We need to create interoperability, and we need to be sovereign about the use of data. Of course, there are reasons, medical reasons, there are legal reasons where there's clear goals of why to use data. but then there's also lots of health relevant data that's not covered through the legislation so directly. But if we want to create this holistic view on individuals and the life events, we need to have those rules in place, and we need to ensure that there's trust. And I think these trustworthy digital services, they are built on a technology, of course, privacy by design, trust by design, the data structures, the data value chain, from the very source data to the AI, how we use AI and create those digital services, to governance models, how skilled and how educated our people are in treating data. It's very often when the ultimate risk is us individuals not caring for the, well, certain privacy issues and being a little bit lazy. So there's a big role in organizations how to build this responsible use of data culture in the end. And during the past 3 years, Sitra has been working very actively on different levels in this fair data economy project, working together with companies, with policymakers, with organizations. And one of the very nice outcomes we made in this project is a so-called rule book template. That's a template that have a range of a set of control questions, starting from ethical control questions, going through technical details, data-related topics, incentives, and those legal aspects that are relevant for your data sharing ecosystems. If you want to have multiple parties sharing data between each other, there needs to be a good foundation where to build on those common rules and agree who gets what and how you handle the data. And all this whole ecosystem should be based on the same principles. So that's why I'm really happy to see how well our rule book template resonates and how many practical implementations we already seen. Although we started this initiative or building the template in 2 or 3 years ago. And even earlier, I've used the SBMS data strategy as a very nice example how you could actually take the data governance an integrated part for your core services. It shouldn't be something that you add on afterwards. It should be something very central from the trust point of view. So, it's been so exciting for me to see the Portuguese translation for the rule book and what I've heard about the application of the rule book in creating this kind of new culture. So it's inspiring. And we are seeing similar examples from the training data rule book being implemented in the training sector. So these are small steps, but I think these are very important and practical steps towards more trustworthy healthcare services and reuse of healthcare data. And for sure, I think we need to broaden our thinking in what is healthcare data. If you want to support individuals in their well-being, if you want to support individuals in their healing processes, we need to have a very wide view on data. So we need to have this multitude of data sources available and create the holistic view and ensure that individuals are in the center and they get all the relevant data, all the relevant information without risking the privacy. So I think this is a very big role, both ensuring that there are rules in place, there are regulation in place, public and private sectors work together to solve these topics and creating these trustworthy health data ecosystems. We wrote in some white papers, working papers on the topic. We work continuously in different processes with this topic, and one working paper is called Towards Trustworthy Health Data Ecosystem. That's recommended learning or recommended reading, where we are trying to draft the future and what the policymakers, companies, and individuals could do to draft this more human-centric future when it comes to the health data and health relevant data. But then there's still one question, and this is my very final slide. And I think it's a fascinating question, because all those big tech players have been very good in creating a very easy to use, compelling digital services that we use. They are easy to use, very intuitive to use. If you want to create those digital services or healthcare services, often much more important and even crucial for our health and recovery. How do we create the same easiness of use, and how we transmit the empathy that we as a professionals, when meeting in physical worlds, can show to the patients? That's one very important question, even in the digital age. And maybe a very good example, normally a handshake between a patient and a doctor. That's an old world, of course. No one can give any handshakes anymore, but that was a very useful source for information. By meeting people, by shaking hands, you could tell, well, the condition of an individual. How is this trick done in the digital age? We have lots of potential in the data, but we need to ensure that we also, well, draft it to the future in a more human-centric way. And we need empathy also when drafting for new digital services. I hope this inspires you, and I'm, as I said, I'm very happy to be here and start and, well, have this discussion. Thanks for the opportunity.
Thank you, Jaana, for your very nice talk and for letting us know the leading work that Sitra has been doing in this fair data economy. So I will start talking a little bit on something you were saying, how this new digital era really will change the landscape of healthcare. And so actually, health data will be a cornerstone for next generation healthcare systems. If we go a little bit back in history, we see that medicine and public health have a strong data foundation. But the fact is that the digital revolution really changed the data ecosystem in the healthcare sector. So data is now more and more collected by individuals in their homes and not by organizations in the healthcare sector. At the same time, these 5 V's of big data, this variety and this velocity, are also changing the way we make diagnoses in medical practice. And so this already fine line between primary use of health data and secondary use of health data, it's further blurred in the digital era. And because my data not only helps my doctor helping me and myself helping me, but it also helps my doctors through the AI-backed operation of information systems, helping the other patients in the clinic, and also helps the wider community through public health interventions, improving health. And at the same time, from a public sector perspective, it really increased the need for strong competencies in data science and IT services that traditionally lay outside the public sector or can be largely improved by the private sector. And so this asymmetry of power and all these changes in the data ecosystem really need to make governments to have a strong commitment with the still fundamental principles of health for all, universal health coverage, and quality of care. And so this fair data economy that Sitra has been promoting, and that for us is really as fundamental as the discussion on European health data spaces or on governance mechanisms that is happening now, it really resonates well with these long-standing principles of health for all that we in public health have been promoting. Because if data is a new value in the healthcare domain, we really need to make sure that it benefits all individuals at the same time, and that hard-to-reach populations will also benefit from the data value that it's coming from these new streams of data. And that's why, as you were mentioning, we here in Portugal welcome very much the rule book for a fair data economy as a practical tool for helping us improve the data sharing ecosystem that we have in the national healthcare sector. Because if we traditionally relied on the data that health organizations collected, we need to move forward and to start bringing data collected by individuals and by the private sector into the public health domain. And this pandemic really shed light on this, on the need for public health surveillance and national health services to be inclusive in their national health information systems. And so data sharing agreements are really fundamental in this role. And just to finalize my intervention is to say that we, in the healthcare sector, we really need to see data as an asset by itself and to make it a core health service and a health service in its own right, because data quality will be paramount to the quality of healthcare and health improvement and also public health intervention. But not least, we need to stress out the need to have a strong foundation and principles on why we are sharing data. And so the fair data economy principles, the human centricity, the role of the individual in managing its own data really needs to be foundational when we as healthcare institutions feel the need to collect and to have more data, even if it is for the wider public good and for protecting the public's health. So we really welcome your presentation, and we want to keep this commitment between Portugal and Finland in improving data ecosystems and making our data governance models, either at the national level or at the EU level, to have a strong foundation in these fairness principles and the value sharing principles that Sitra has been pushing forward at the EU level, and that really benefit public health so much. I will finalize here my comment, and I will leave room for João to lay another perspective on your very good thoughts on the fair data economy. João.
Thank you, Cátia, and really thank you, Jaana, for your very interesting presentation and on a very short period of time. So I think you addressed really important topics for institutions and companies and people doing business in the healthcare, right? So I'm assuming that I'm coming from the private sector, and I think that we need to realize that healthcare is a business, right? So it's a business care. It's a business that intends to promote well-being of the population, but somehow it's also a business. I would like to stretch, and I will address some topics that I will also put as challenge for us in this sector to address, and I would like to hear both Jaana and Cátia's perspective on that. I really like the concept of the value in data is not on the storage, but on the use of data, right? And I come from the private sector, so I run a market research firm that do research on the pharmaceutical sector. So we do collect data to generate information about the pharmaceutical sector, the way products are being used, consumed, dispensed. And I think that really in our core position is that the power of knowledge grows when it's shared. That's the way we as a company believe that it's our role in this sector. And I really believe, and Cátia addressed that as well, that in healthcare, we were used to an asymmetry of power, right? Both on the decision-making process, so healthcare professionals, both physicians or pharmacists and the patient, we are used to a very discrepancy of asymmetry. So the power of decision, it's really on the healthcare practitioner and not on the patient. And I would say that on the access of data, in the past, we were also used to this high level of asymmetry. In sometimes it was the private sector that have more data regarding the government agencies or the institutions, and both sides were, I would say, using or benefiting or misusing for this asymmetry. And I think that the big challenge for us in this sector, in this business, is to find a way that data can really reduce asymmetry and put the different parts at the same level on having access to data, respecting what needs to be respected: privacy, security, and protection of the data from the different institutions or individuals. So I really think that the challenge for us is to find a way that data can be easily or in the fair and transparent way accessible to different parties that can benefit from the use of data, use and reuse. Of course, that's a big challenge for institutions like in Portugal, that for this we need to promote interoperability of the systems. We need to run away from one unique systems and closed systems, but that's a challenge for the National Health Service in Portugal and the other service. So that will be my first topic that I think would be good to address. And the other topic I would like to address is the value of individual data versus population or group data, right? So, and we as individuals, or we as institutions, or we as healthcare organizations need to understand that the value of individual data is limited when we compares the value of population or group data. As Cátia was saying, that could be nowadays really powered by advanced analytics, by artificial intelligence, machine learning, all the new technology. And this is a barrier for us. We need to understand how we can contribute with our own individual data from a person for an institution to the large benefit of a society. And that for me also is a challenge that we need to address. This will be easily solved if we understand data as a common good, right? Really the concept of data equity or common good, because I really believe that we will be more efficient as a society. We will take better decisions on the resources we need to allocate to funds for what we are more close to in our case of the business I run, to funding medicines, to innovative medicines. So if we find a way to be more efficient on shared data from the service and products providers to the healthcare systems and from the system, we will be more efficient. We will take better decisions. We will not spend money on things we should not spend because the data will tell us that it's not good to put money there. But that will require that we leave some mental blocks that we still have on sharing data between public and private, or between healthcare organizations and the providers. So I think that's something I would like to hear from both of you. And I will finalize from the people centricity perspective. This acceleration of digital in our society is creating different groups of people, right? The people that are easy, or I'm missing the word, but that are easy to use digital and digital apps and how to manage apps, and the others that are not. And as the population is getting older, and this will create the different barriers, because maybe on the population that we will benefit most to have data, on the elderly population, the people with chronic diseases, are the ones that are not easy to share their data because they are not so digital adapted. So that will be my comments, and thank you very much for the opportunity.
Jaana, do you want to make a final comment after this lively discussion that we are having?
Well, there's lots of happening, of course, promoting the idea of data altruism. We are seeing that in the Data Governance Act, so that's maybe a little bit like a legal ground for gathering more wide sources of data, but then these mental blocks and also being very focused on those that have not, those who don't have very high digital skills. That's maybe what I meant with user friendliness. We need to have those data nurses who explain and help and assist in using data literacy and using digital tools. And also we need to have a much more stronger approach when developing digital services on gamification and also this user friendliness. So maybe that's the only way if you want to, well, appear as professionals being empathic also in the future, while still we all agree that efficiency comes from the data and digital tools.
So I would like to conclude our session today by thanking our speakers. I know our audience will leave this session with a lot of their mind. I know I will, for sure. This is a very important topic. And I think one message that we would like to relay is let's build a fair data economy. And for that, we can all work together and cooperate, and then we'll make a strong path to get to our goal. And I'd like to thank once again for everyone attendance, and please stay tuned for the next sections. And thank you and have a nice day.